A very good day, my dear postgraduate students. The topic on the screen is a little weird approach to difficult topics. The dictums of common sense. And this is an experience that I had obtained over several decades. And most of my classes, in fact, all are around the university questions. Sorry, I am not very clear. But then, instead of simply meandering, it is better for us to lay down some concrete pathway so that we reach our destination, namely acquiring the degree. Pause and think. The greatest fool can ask more questions than the wisest man can answer. This should have been your personal experience in many a situation, particularly in the postgraduate programs. Thanks to Dixon, an author of a very small book that paved way for MRCP. Let us be very frank. Whether in a class or in a conference, when a question is being thrown at the audience, how frequently do you see such a scenario where nearly all the adjacent hands are raised and the finger very confidently points up? Does this really happen, if at all in pathology? It will be better that we analyze the types of questions we face. There are different types of questions in the sense there can be a recall type, an undergraduate type of question, technical, pathogenetic, indicating the development, etiopathogenesis, both the etiology as well as the pathogenesis, classification, changing with the changing times, morphology, what we see, microscopy, what we see under the microscope, and diagnosis, what we ultimately do as a pathologist. Now, I would like you people to kindly do one small homework for me. You are all tutors and tomorrow's faculty. I would like you people to kindly set a set of questions either for the undergraduate or for the paramedical or even for the postgraduate junior students of yours. Because this is what we are seeing. This is an MD degree examination. And the exam is somewhere around 2020 or so. I do not know the exact. Okay, 2010. Fine. I would like you people to kindly analyze the questions for comments. Something on IBD, then an essay on vasculitis. What I am seeing is a list of short notes, some of which again appear to be very simple functions of vitamin D, but not so simple so. Infective endocarditis, quite straightforward. Whereas bacillary angiomatosis, not a very common term, and nesidioblastosis, not common to the postgraduates. So how do you prepare for such a list of questions in a paper? You find that it is a myriad. It has got nothing to do with the reporting that you are doing, nothing to do with the practical discussions that you are facing or the journal clubs that you are delivering. And this I would advise you. Kindly try to trace the origin of the questions to any of these. It can be your undergraduate text, your postgraduate, Robbins, and then any of the references, later edition of Robbins. There is a lot of difference between the earlier editions and the later editions. At whatever text you people are going to. Similarly, a clinical pathology and recent advances, R.A.T.S, etc. Finally, your own golden notes. This can be the types of questions that we are going to get. It can be applications, which means enlist, interpretation, genetic, molecular, latest advances, abstract questions, analytical, practical, day-to-day, - not common. See, this is somewhat, very abstract and somewhat mind-boggling. But let us see. These can be from various sources, including recent advances, R.A.T.S, Ludwig, Robbins, and so on. And I am giving you a list of examples. Applications, it can be a flow cytometry. Interpretation, renal biopsy. Genetic, the leukemic basis. Molecular, WHO classification. Latest advances, particularly with the COVID-19 around. We have had an entire series of recent advances based on COVID. Abstract questions, smoking. Analytical, an approach to bleeding disorders. Day to day, what is related to your grossing or reporting? Practically, what you people should and would do. A PA staining. Not common, but must know because it is a definite large chunk of your question paper. Practical questions, autopsy. Okay, another question. In this one, I would like you people again, what your observation is. I'm just magnifying it for your vision. Endoscopic biopsy. Nephritic syndrome, more of an undergraduate one, and how do you classify? Directly from Robbins, we can get the answer. But then, cutaneous lesions in AIDS, not very common. Mesothelioma in any of the common references like Ensing and all, you will be able to get it. And there are certain other things. Metaplastic lesions, not very simple as the metaplasia that we read, but there is an entire essay on metaplasia in the recent advance, which I had presented. And there are the others also. So I would like you people to kindly analyze and appreciate the difference between the different types of questions. It is very unfortunate that the students are being thrown the questions around them and there is no solution in sight, which is exactly the reason why I run R.A.T.S. Now I would like you people to recall. Recall in the sense it is straight from the text. There is no word here or there. And even in such cases, the dictum I always give my students is, let it be megaloblastic anemia, for example. Read from two sources. It can be Tejinder Singh as well as your Robbins. No book gives pathogenesis as well as Robbins. Your experience itself will suffice. After some time, you will be knowing. But then ultimately, that should be a golden notes of yours. Follow the UG questions. And fluency in Viva matters. This is one thing. It will appear that the question is quite simple, but then how fast do we answer? Because you have got your own colleagues facing the exam. And it is only the speed that matters in this case. And most of the things you people already know. 2001 and 21. Is there any change? So this is 2001. Let us go to it and then see the types of questions. Those days, there were certain topics which were okay. The conventional ones were peripheral smear in hematology. But sadly, some questions like this are being asked even now. Automation in hematology. Vague questions like fluid cytology or hypersplenism, which is direct. PNH, a direct question as such. But what are we getting in 2021? Immunology of malaria. Kindly compare and contrast. Hemophagocytics, WBC histogram. One is regarding a peripheral smear. Here it is a totally different one. Autoimmune hepatitis. So there is a great difference in the questions. And also you find etiopathogenesis and pathology of endometrial tumors. Maybe this is something that we people will have to refer to the reference text as well as the recent advances. R.A.T.S. Racing against time for students. This is a beautiful theme that, in fact, I should thank my postgraduate students for helping me arrive at such a novel idea of R.A.T.S. Read the R.A.T.S, listen to it, and go to Robbins. Many of your problems will be overcome. And when it is an etiopathogenesis, remember you are a teacher. You are going to explain the no, how, why, when, and the solution to the various conditions. You can judge. And actually, common sense matters. Look at this over here. There is an iron deficiency anemia, megaloblastic anemia, pernicious. There is a fine line between these. As a postgraduate, you should be knowing the clear demarcation between them. Gastric carcinoma and peptic ulcer. Very simple question that has been asked for several decades, if not centuries. In this case, answering does not matter at all. How fast you answer matters most. It is something like the final rounds of a quiz competition. I always believe in this. My student knows more than me. For example, you people know the different methods of classification, the lymphoma, the updation in the WHO, incorporating the molecular mechanism. And it is no secret that the student knows the latest better than the teachers. In fact, good teachers will be taking the question paper, going through it, preparing the answers before they come for corrections. Techniques. The techniques can be, for example, fish is a question for us, immunofluorescence. Not all of these techniques will be practiced in all the centers. Chromatography. And where do we get the answers from? For all this, a compilation is mandatory. Notes. Nothing to replace your golden notes. And avoid scattered reading here and there because it just goes into a dustbin of no use. It has to be retrieved, it has to be studied at any time. So, look at this one. Where do we find the answers for these? Is it in pathology? The technique. Some of them are pure physics questions. Molecular, laboratory medicine, biochemistry again, and radio, immunology, recent advances. Some of them are there in the recent advances as well. But all said and done, notes are mandatory. An interpretation. This is a question beyond the realms of the postgraduate student. However, these are very common questions. High level, it needs a theoretical background. Gross and microscopy, you people should be well versed with. And there are the fundamentals of immunofluorescence, electron microscope, or IHC, etc. Special stains. This is a list of examples. Interpretation of a muscle biopsy or a renal biopsy, malabsorption syndrome, etc. So this is one. Obviously, a preparation is greater than reading several books. Day to day. This is a wonderful one, and I would like to thank McGraw-Hill, a beautiful compilation and a very simple theme, just the urine sediment. See what all is there. And please do remember, student, urine carries a lot of marks, hidden marks in your examination. What is the acidic urine? What is the alkaline urine? What are the crystals, amorphous substances? What are the various gas? So on and so forth. And there can be further questioning on this, provided you people answer well. Also, you find that there can be the questions regarding any of these things. In your center, for example, do you do ISC, immunofluorescence, PCR, urine sediments, and the routine? In fact, people never go this side and they lose a lot of marks. They are always clinging on to the histopathology slides. So definitely a compilation will be needed of the day-to-day actions. In fact, most of your practicals will be revolving around your laboratory activity. Before I end, reading. You should be reading all the pages and reading in between the lines. This is a beautiful habit. So reading in between the lines means you try to make out what is being missed, either in the book or by you, and then you trace it. You find certain hidden treasures and repeat. Repetition is the mother of knowledge. So, very simple. We do start, and it is a step-by-step procedure. It is not that I work on a goal all of a sudden, and then I do not walk these steps. I have to do it progressively, and ultimately, you people will definitely reach your. I thank you for your patience.